This segment of CoastLife is sponsored by Beebe Healthcare.
Well, I know that February is winding down, coming to an end, but it is still technically Heart Month, which means it's still important to make sure that you are well informed about the cardiology and your overall heart health, and maybe some signs that we should get into in case something is wrong. I'm not the expert, but I know who is. We've got Dr. Prasad joining us with Beebe Healthcare. Now, you are a cardiologist, but talk to us a little bit more about your role within Beebe Healthcare before we dive into some of these heart health details.
Sure. Thank you for having me here. I've been in Sussex County for 21 years, and at Beebe we have a robust cardiology program that includes general cardiology, preventive cardiology, cardiac rehabilitation. We do a very big interventional program as well as cardiac surgery program.
So maybe let's talk about some of the preventative measures that people can take to prevent heart disease, especially at the beginning of the month. If you remember, we were talking about women's heart health. Why is that such a hot topic right now to talk about? Because some of those symptoms look different between men and women.
Absolutely. You got it right. Women health has always been ignored, not even for heart, for every part of medical field. For cardiology especially, women health is so important because these are people who are our mothers, who are our family members, who give birth to us, who are most important members of our family, and they have never been taken a priority. I can tell you simply that in my practice, women come and they give their appointment to their husband or to their other family members, and then they don't come for follow-up for years. I hate to see that, because then I see them in the emergency room when they are having a heart attack. Most important part that we all have to understand is women have atypical symptoms. They are not coming up with clinching chest pain where they will come to you and say, oh my goodness, my chest is hurting so much. No, they will have all atypical symptoms. For example, shortness of breath, mild chest discomfort. Some women might say, oh, I have upper back pain. Some will say, oh, I'm dizzy. I feel like I'm going to pass out. I'm tired a lot. One of the most important symptoms I see is they get tired very easily. So most important thing we can do as a community, as a physician, we can educate ourselves so that we are aware of those symptoms. Once we are aware of those symptoms, we can take them better. We can take them seriously and get testing done. We have preventive measures. This community is full of beautiful areas. We have walk trails, we have beaches. You just have to use them. I see so many patients who have never been onto any walk trails. They never go on biking. They never go on a beach side. Most important thing, they need to use this community very well. We have resources. They just need to come out of their house, especially women, elderly women, in their 80s, 90s, they are bound to their home. They need to come out, use our community well, and that is first step they can take towards the heart health.
Earlier you also mentioned cardiac rehabilitation. What does that mean?
So, good question. Very important part of all cardiac care. Anybody or everybody who gets a heart attack, who gets a stent placement, who have a congestive heart failure, also who have bypass surgery, they all need to understand why they got to that point where they needed all that. People who have done cardiac rehab, they live longer. Good. So our goal is to get to them to that point and give them a new life, a new starting point.
Yes, you give somebody that second chance. It's an alternate plan, really. It's a lifestyle change for a lot of people. Well, yes. Dr. Prasad, thank you so much for coming in and making us aware more about either whether it's symptoms for women's health, if there is a cardiovascular event happening in their life, and really just a good reminder to make those doctor's appointments. Maybe it is a good day to eat a little healthier if you haven't quite made your dinner plans yet, and take yourself for a little evening walk today and take care of your heart, because we want you here with us for a long time. So thank you again, Dr. Prasad.
Thank you.
Of course. Coming up on CoastLife, though, we're also not done with February, which means we're not done with Black History Month. We still have some more to celebrate when CoastLife gets back.